Hello and welcome back to my channel. Today I'm going to take you through a 15-minute pregnancy mobility routine that is perfect in your third trimester to prepare for birth and also to prevent the risk of tearing. Come down onto your hands and knees and we're going to perform some cat and cow. So I want you to arch your back as you breathe in, and then I want you to round your back and look towards your hips as you breathe out. We're really mobilizing here through the lower back and the hips. We've got 4 in total. Take a nice deep breath in for 4 and a nice deep breath out for 8 as you round that back and really feel a lovely stretch through your lower back and down into your hips and pelvis. We've got 2 more here, so as you arch your back, I want you to take a nice deep breath in, and then as you round your spine vertebra by vertebra, I want you to look your head down towards your pelvis to get a really nice big C curve right from the top of your neck down to the bottom of your spine. We've got 1 more here, nice big deep breath out as you round that spine for the final time, and then we're going to come into a nice neutral position. We're going to spread our knees out wide to accommodate room for our growing bump, bring our hands forwards and push backwards into a child's pose. We're going to do some child's pose rocks with our knees pointing outwards, so our hips are in external rotation, which is really important for allowing the pelvis to open to allow baby to move through the birth canal during birth. We've got 4 in total here. Make sure to take it nice and slowly and try and come down as far as you can whilst accommodating room for that bump, and bring your hips forwards to get a nice stretch into those hip flexors. We are going to then repeat this movement with our hips in internal rotation. So after you've finished your external rotation rocks, you've got 1 more nice big deep breath out as you press backwards, and then a nice breath in as you come back onto your hands and knees. We're now going to bring our knees in to meet each other and take our feet out to the side to change the rotation of our hips into internal rotation. Now, as you rock back into child's pose here, you'll probably find that you can't go back as far as you could when you had them in external rotation. This is completely normal. It is due to the anatomy of the hip. We just don't have as much mobility in this position generally, and you also might find that your bump gets in the way a little bit as you press back. So just go as far as feels comfortable. You want to feel a nice stretch around your hip, but you don't want it to be painful. Any sharp pain, then just ease off a little bit. But we've got 4 in this position, and again, make sure you're exhaling as you press back and inhaling as you come back up. We're now going to come into some frog rocks. So I want you to take your knees and your feet out as wide as you can, so they might be just slightly off the mat. Come down onto your forearms, and then we're going to press back. We're going to press our bottom back as far as we can to really feel a really deep stretch into those hips and that pelvis now. So we're really opening up as wide as we can in this position, and just take it nice and slowly. Again, breathing out as you press back into the rocking part of this motion, and breathing in as you come forwards. We have got 8 frog rocks in this position. This is really good for opening up the pelvis, opening up the hips, and creating a lot of space in the perineal area, which is where we are trying to get nice and limbered to make it as smooth and soft as possible to avoid tearing during childbirth. Now we're going to come up and we're going to hold a prolonged stretch in puppy pose. So come up high onto your knees, lift your bottom up towards the ceiling, and extend your arms forwards and look forwards as much as you can, bringing your chest down towards the floor. This is a really lovely opening position, and again, it can be really helpful for getting baby in the optimum position for birth. So we're going to hold it here for a few deep breaths in and a few deep breaths out. Really try and relax as much as possible and let your chest sink down towards the floor as you hold this position. And now we're going to come back up, and we are going to take our hips in and out of internal and external rotation again. So you're going to internally rotate your hip to take your foot out to the side, and then you're going to take your knee out to join it and slightly wider, and then you're going to come up onto your foot and press back into a rock back. So this is a nice 3-point movement. So the first part is taking your foot out to the side, take your knee out to meet it, and then press back into a rock back. Making sure to take a nice deep breath as you bring everything back into the middle, and then a nice big breath out as you press back into that rock back. We have got 5 on each side here, so we're really really mobilizing through the pelvis again. We're combining internal and external rotation as well as some hip flexion here, which is just going to really help to open up the area and the birth canal, which is where the baby wants lots of room to move down during birth. We're now going to do it on the other leg. So the same thing, you want to make sure that you're taking your foot out to the side, then your knee out to meet it nice and wide into external rotation, and then push back into that lovely half child's pose. We've got 3 more on this side. Make sure to concentrate on your breath. You're keeping your back nice and neutral throughout the movement, making sure to hug the baby, so thinking of drawing your belly button up towards your spine to maintain a nice neutral spine and nice core engagement throughout. This is a really lovely one to work into those hips again and that pelvis, which is going to just be really beneficial for the mobility required during childbirth. So we've got just 1 more here, and then we're going to come back onto our hands and knees, and we're then going to do some wide abduction rocks. So I want you to take your leg out to the side and extend it so your knee is nice and straight, and we're then going to press back into another half child's pose, but with our leg straight this time. And as you're back in that child's pose, I want you to twist your leg, so rotate from the hip to come into a little bit more of hip external rotation when we are at the bottom of that movement. So breathing out as we're pressing back and twisting that leg, and breathing in as we're coming back onto all fours. Final 2 here before coming back into the center and swapping over onto the other leg. So breathing out as you press back into that adductor rock, and then breathing in as you come forwards. Now let's take it over to the other side. So extending the other leg out to the side, making sure that it's in line with your hip, pressing back into that half child's pose as you breathe out, and twisting that leg and that hip around into external rotation. So we've got 3 more on this side. So a nice big breath out as you press backwards, twisting that leg, and a nice big breath in as you come back onto all fours, exhaling out through your mouth, rotating from the hip, and then inhaling to come back onto all fours. We've got 1 more here, pressing back as far as you can that feels comfortable for you, and then coming back and moving on to our next exercise. Come into side lying and place your head in your hand, making sure that your hips are in line with your shoulders and that your knees are bent at about a 45-degree angle. We're then going to take the top leg up into half happy baby. I want you to hold on to either the outside or the inside of your foot, whichever feels most comfortable for you. Keep a nice bend through your leg, and then pull your knee down towards your armpit. We should feel a nice stretch into our hip, into our hamstring, and into our perineal area, which is obviously great to prevent that tearing. You can slightly rock your leg backwards and forwards in this position, just nice and gently, to create a little bit more movement and mobility in your hip and in the area. We're going to hold it for about 30 seconds in total, so take nice deep breaths in and out through the mouth and in through the nose, and just really try and sink that knee down towards your armpit as much as you can. We're now going to press up and come into another exercise that works the hips into rotation. So we're going to do some windshield wipers. So place your hands behind you, palms flat on the floor, and lean backwards, and we're then going to take our knees from side to side, trying to get our knees as close to the ground as you can as you move them from side to side. So one of them is working into external rotation as the other one is working into internal rotation. Keep a nice bend in your knee throughout, and try and keep your bottom down throughout the movement to really feel that stretch into rotation. We're going to do 10 in total here, taking it nice and slow before coming down to lie on the other side, placing your head in your hand and repeating the half happy baby stretch. So we're lifting the other leg up this time and holding on to either the outside or the inside of your foot, whichever feels most comfortable for you, sinking that knee down towards your armpit and really relaxing into this stretch on the other side, mobilizing through the hips, hamstrings, and the perineal area, and again just rocking that leg gently backwards and forwards as we hold it for about 30 seconds in total. This is a really lovely stretch to relax that whole area around your perineum and just get prepared for some of the positions that you might be getting into during childbirth itself. So take nice deep breaths out through the mouth, in through the nose, and really try and relax for the full 30 to 60 seconds here. If you want to pause the video and hold it for even longer, then please feel free to do so. We're now going to press up and come into a pigeon pose stretch. So I want you to place your arms out in front of you, bring one of your legs forwards, bend at the knee, and then bring your foot forwards as far as comfortable so that you feel a stretch into your bottom muscles at the back. This is lovely for your glutes. And then just hold it in that position, or if it feels comfortable for you, you can come down onto your forearms, extending that back leg behind you as much as you can. But if you need to keep a soft bend in the knee, then that's absolutely fine. I like to rock from side to side in this position, again, just to mobilize into those hips as much as possible, and make sure that you're sinking down and you're relaxing. So really use that breath as much as possible. Try not to hold on to any tension when you're in these stretches, because then we're not going to achieve what we're trying to achieve. So this is going to really loosen up all of the muscles around the back of our pelvis and the back of our hips. The aim is to hold these stretches for about 30 to 60 seconds at a time, but to remain relaxed throughout. We're now going to come into a half straddle. So I want you to press up and keep the same leg bent, and we're going to extend the other leg out to the side. We're then going to lift the same arm as the bent leg, and then we're going to reach over the side of our extended leg and look up towards the ceiling as much as possible, so that we can feel a nice stretch down the side of our body and into our adductor, our inner thigh muscles. We're going to hold it here for about 30 seconds, taking some nice deep breaths in and out, in through the nose and out through the mouth. Again, really trying to sink down, but keep our sitting bones, so our bottom, firmly rooted into the mat throughout. We're now going to come into a full straddle. So if you extend that bent leg out to the side, and we should really feel it in those inner thigh muscles in this position. If you just need to hold it with your spine upright, that is absolutely fine. But if you've got a little bit more flexibility and you can come down onto your forearms, or extend your arms all the way out and get your forehead to the ground, but keeping a nice neutral spine, then that is absolutely fine. You can take some small rocks from side to side. I really like to do this to work one side slightly more than the other, and just again to create a little bit more movement through the hips and through the pelvis. I really love this stretch, and I actually like to hold this one for slightly longer than 60 seconds. Sometimes I hold it for up to 5 minutes at a time, because I really think releasing the adductor muscles, which can get really tight, especially if you've got a bit of pelvic floor tension, is really, really important, and it's going to be so beneficial during birth to allow us to get into those upward, forward and open positions, which are really beneficial for allowing gravity to help us bring our baby through the birth canal. We're now going to do the half straddle stretch on the other side. So if you bend in the leg that wasn't bent before, and you're going to take that same arm over your extended leg and look up towards the ceiling as much as comfortable for you, making sure to keep those sitting bones rooted into the mat, and we are feeling a nice stretch through the side body here. This is really lovely, because often we don't stretch into the lateral areas of our body, so the side areas of our body, as much as we should, and it can feel like such a nice release, especially if you've got any tension around your lower back. We are then going to press up after about 30 seconds and come into pigeon pose on the other leg. So we're going to place the other leg in front of us this time. We're going to bend the knee, bring the foot forwards as far as feel comfortable, and then we are going to extend that back leg behind us as much as we can, trying to bring our hip down towards the floor. As you can see, my hip flexor is quite tight, so I can't quite reach the floor with that hip flexor, but that is the aim of this stretch, as much as we can. So we're now going to do some gentle rocks. Come down onto your forearms if that feels comfortable for you. I find that I can sink much more into this stretch if I am on my forearms as opposed to up on extended arms. So we're going to rock slowly from side to side. You might find that one side feels more stiff than the other. I definitely do, but just try and take some nice deep breaths to really relax down into this stretch as much as you can. Again, we're going to hold it for about 30 to 60 seconds. If you want to hold it for longer and pause the video, then please go ahead. We are now coming into the final two exercises of this mobility routine. So I want you to come up onto your knees and then step one leg out to the side at a slight diagonal 45-degree angle. We're then going to press our hips forwards into that lateral lunge as we take our arm overhead to feel a lovely, beautiful stretch through the back hip flexor and into the hip of the leg that we have in front of us. This again is going to create some beautiful space and a beautiful stretch in our perineal area, as well as working into those hip flexors and around that pelvis in that sideways motion. So coming into these lateral positions is, again, like I said, going to be really important for mobilizing around the pelvis, creating space in the birth canal, and just allowing movement for baby. We are now going to repeat this on the other side. So we're doing 5 in total. So really breathing out as you press forwards into that lateral lunge, breathing in as you bring that arm back down and coming back onto your supporting knee. We've got 3 more here, so exhaling, pressing nice and slowly, inhaling as you come back, exhaling as you come down into that lunge and inhaling as you come back. This mobility routine has had a really nice mix of rocking motions and holding prolonged stretches, which I think is the best for just relaxing tissue and relaxing yourself so that you can actually feel like you're stretching and not just holding on to tension throughout. The final movement is we're going to come down into a deep yogi squat. Now, if you find this position really difficult, you can either take a seat on a step or a low block, or you can pop your heels up on some small raises, because sometimes it is your ankle mobility which is stopping you from coming down into that deep squat. I want you to use your elbows to press your knees out as far as you can. Keep your heels on the floor if possible for you, and just take some gentle rock side to side. This is often a position that women actually end up giving birth in, a nice deep squat, so it's a really good one to practice, and again just to allow all those tissues to move into a nice open position to allow us to be as ready as we can for birth. Just remember, there are lots of factors that can affect perineal tearing, but if we can mobilize around our hips and our pelvis and the tissue around the perineum, then we are doing everything we can to prepare for this and to hopefully reduce the risk. Thank you so much for joining me for this 15-minute mobility routine in our third trimester, and I'll see you in the next video. Make sure to like and subscribe.